Okay, so we're moving to the next type of arthritis. So of course, once you see tuberculosis, you're now talking about something that came in as a result of what? Extra pulmonary tuberculosis. You know, tuberculosis normally affects what? The lungs. So the ones that affect the lungs, we call it the pulmonary tuberculosis. But if tuberculosis is now spreading to other parts of the body, affecting the kidneys, affecting the joints, there are different types, okay? Different types, we call it the extra pulmonary. That means what is affecting structures outside the primary region of what affectation, which is the lungs. So tuberculosis arthritis is also what? A kind of like joint inflammation that could actually what? Occur, when somebody has what? Has tuberculosis, right? So it's a chronic joint infection, and it's usually caused by the microorganism that causes tuberculosis. That's the Mycobacterium tuberculosis. It's a form of extrapulmonary tuberculosis, just like I'll tell you guys. So it mostly affects what? Joints that bear weight, like the hip joint and the knee. But any joint can be affected. Like you see the fingers are affected here. Let's look at the other picture. Mostly you see the knees are affected. Okay? So a lot of things, right? So you can see this person, the toes are affected. Can you see how the toes are so big? Okay, can be affected. So pathology, the infection usually is spreading, okay, through blood from the primary area of what infection. So the bacilli is now lodging in synovium or epiphysis, leading to granulomatous inflammation. So there's now progressive destruction of the cartilage and the bone, okay? So it will lead to joint deformity and what? Ankylosis. Okay. So clinical features, you should know that what? The infection is slow, because primarily what the microorganisms shouldn't even affect that place. So it's slow because it's like a new site of infection. So later on there will be pain, there will be swelling, there will be stiffness, restricted range of motion, cold abscess formation, systemic issues. That's where the infection is now tracking through blood, spreading to other places, fever, weight loss, night sweats, you understand, port disease, okay, affecting other sites like the hip, the knees, the spine, the ankle, the wrist. You can pause to observe the pictures. Okay, so on the radiograph, you see all those periarticular osteopenia. That's loss of bone density around the joint. Soft tissue swellings. As it progresses, you see marginal erosions of articular surfaces. Gradual joint space narrowing. So the space around the joints will actually start going back. Advanced, you see severe destruction of the bone ends. Okay, subluxation or dislocation. Then you see fibrous or bone ankylosis. Okay. Then you also see the femistous triad, where you see the juxta-articular osteopenia, peripheral erosions, and gradual joint space narrowing. We'll talk about all of them later. So you diagnose it from imaging, X-rays, MRI. You do all those blood tests for what? Erythrocyte sedimentation rate, C-reactive proteins. Of course, it's actually a complication of tuberculosis, so you use what? Anti-tubercular therapies. Immobilization, the person has to rest and not stress that part of the body like before again. Physiotherapy, okay, debridement, synovectomy, or some joint replacement, what? Surgeries.